Well, it's lovely to be here. Thank you very much, Nigel. I don't think there are too many of you. I think you all look great. So the changing welfare state, how to think about the changing welfare state. It's tricky. One thing I think we need to be incredibly clear about, and it's very easy, I find very easy to forget, is quite how much change has gone on. Year by year, we tend not to see how much change there is, but over the last 50, 60, 70 years, there has been quite extraordinary change. And as I thought about this last night, which I confess when I started thinking about it really carefully, I became more and more persuaded that I wasn't sure that the welfare state was the right name to use anymore. And I feel as though I've spent 40 years working in this area and just slipping into using the phrase welfare state as a shorthand for stuff. But my own feeling as I reflect on it now is that actually the set of ideas that are conjured by that phrase welfare state in many cases have really powerful historical resonance, but aren't necessarily calling to mind the right ideas, the right questions now. I think there's a real possibility that we might want to start thinking differently. So the obvious question then is, well, what would be a better name? And here I have to say, I think I've failed dismally. So I haven't got a good name, but I've got, I think, a better description, and that's collective provision. I think the idea of using the word welfare state strongly implies redistributive action that is helping identifiable needy groups. And that's I think, not a good way of characterizing health, education, and even large parts of our social security program anymore. So what I want to have in the back of my mind as I go through this morning is that I think we should be thinking about collective provision. And if welfare state is still a way for you of describing that, then fine. But I think collective provision is what's in my mind. And it's also worth saying that I think we need to be very clear that this set of activities, whether we call it the welfare state or collective provision or something completely other, it's very important that we find good ways of ensuring that what we do reflects our collective desires. And I'm not sure that the political system over the last 30 or 40 years has necessarily done a very good job of doing that. Okay, so let's start with some numbers. After all, I do love a number. So just start. So this is the welfare state, social security, health and education, state provision of social security, health and education, expressed as a share of GDP. And so the really striking thing is back in 1953-4, you added all of those three things up, and they amounted to 1/10 of the national economy. Now you add those three things up, and they're 1/4 of the national economy. That's a big change. It's a really, really very big change, and it's one that we can't underestimate easily. One of the consequences of that very substantial growth in the size of these programs is that they've become massively more significant in overall government activity. So this chart shows you the spending on those three items as a share of overall public spending. Back in the early 1950s, this characterization of the welfare state was 1/4 of public spending. Now it's 60%. And that has had huge consequences. In particular, the impact that it's had as perceived by the Secretaries of State for services other than these three. The growth of social security, health, education has been perceived as having either driven out or made it much more difficult for other areas to get what they would think of as their fair share. Let's look at the three component parts. So this is social security. Social security is probably the most misunderstood of these areas because our sense is that many people, including many politicians, think social security is about the unemployed or the indigent or the poor. Actually, it's about older people. And the growth has been about the growth of the numbers of older people, I'll come back to that in a minute, and the increased relative generosity. And this is now a big programme. Started off at about 4% of GDP, now around 12% of national income. This is a very, very large activity. As I say, most of it is not about payments to the unemployed or those who are completely without any possibility of looking after themselves. Most of it is about payments to older people, reflecting contributions they made earlier in their life. It's about life cycle redistribution. How has that been possible? How is it possible to go from 4% of GDP to 12% of GDP without, over that time period, a massive increase in taxation? Well, one answer was fewer soldiers and bombs. So the biggest decline in public spending as a share of GDP has been in defence. We were up at 9% of GDP in 1953 on defence. We're now down at 2%. Part of the reason for putting that on is to show that most of the things that could be cut to help provide funding for education, health and social security have now been cut to a level where, if we're to carry on with them at all, there's not much left to go. I mean, that's true of defence. It's been true to a large extent of capital spending and in areas like housing. So one of the consequences of the growth of welfare spending broadly, without significant increases in tax as a share of national income, has been that other items of public spending have been squeezed. Health, probably the thing closest to the heart of many of the people in this room. So we started off back here at about 3% of national income. We're now up at 7-8% of national income. My rule of thumb in these areas is essentially public spending on health in a system like ours is likely to rise by roughly 1% of GDP every 10 years. And it's going to do that pretty much whoever is in power. And if we have a period when it doesn't, then it springs back up again, and the increased spending. I think am I swinging in and out of? I'm all right again now. The increase that we've just seen announced is, I think, the consequence of just that. We had a period of very low growth. They're not sustainable. We've had a number in the past. There was the period of there was kind of Thatcher squeeze here, followed by a Thatcher boom. We had another squeeze in the mid-1990s, followed by the Blair-Brown increase. This is going to go on rising at, I think, roughly 1 percentage point of GDP every decade. Put education on as well. So education started the period at about the same scale as health, grew much more quickly. So by 1975, education spending is roughly 50% higher than health. Now, when you ask most people what they want to see an increase in spending on, one of the things at the top of their list would be education. And this is where I want to just ask how successfully our political structures and ourselves as are delivering what we think we want. That's what happened over the 40 years or so since 1975. So in 1975, education spending was about 50% higher than health, not quite 50%, but since 1975, education spending has bobbled around as a share of GDP, and is actually now lower as a share of GDP than it was in 1975. Now, it's possible that there were lots of people in 1975 and at every point subsequent to that who thought that was what they wanted to happen, but I'm not sure I've met any of them. And I think there's a real question for our political structures and democratic processes about how and why that has happened. And my hunch is it's because if you're the Secretary of State for Health, it's much easier to get more money out of the Treasury than it is if you're the Secretary of State for Education, because you've got a plausible shroud to wave. You've got a plausible hospital crisis, a plausible winter flu disaster. Stories that actually are politically extraordinarily salient, that make it feasible in our rather peculiar way of controlling public spending, where public spending plans don't often get hit. There's almost always some extra. A lot of the extra has tended to go to health, which is not something I regret, but I do actually regret what's happened to education. It seems to me that that is not something that we necessarily intended. just put all three of them on again. And so essentially, health and social security follow much the same pattern. Education follows a radically different one, and a radically different one that is not well known or understood, and I think is genuinely quite puzzling. If the relationship between health and education spending now was the same as it was in 1975, education spending would be twice as high as it is now, and that's a pretty dramatic difference. Why has all this growth happened? Why has the growth happened in health and social security in particular? Well, part of it, a non-negligible part of it, is just numbers of people. Number of older people is growing. This is expectations to 2030. We're expecting a doubling of the number of people aged 85 and over by 2030. In 2030, I often said I really hope I'm in one of these two bars, because my 70th birthday is in 2030, and if I'm not in one of these two bars, then I'll be dead, and I prefer to be in one of these two bars. These changes are dramatic. I mean, the demographic change is expected to be significant. It's worth saying the demographic change we've already seen has been much more significant than the demographic change we're expecting. So this is numbers of people aged 85 and over going back to 1901. In 1901, there were 61,000 people, according to the census, and the census is always right, aged 85 and over. By 2011, 1.447 million, and we're expecting that to double in the next 20 years. So the change we've already seen has been at least as dramatic as what is coming our way. What other big changes have happened? Well, I think perhaps the other biggest change that's happened has been the change to both the level and the composition of the income distribution. So the levels of income and how they relate to one another. Here is the income distribution in 2013. Household income distribution normalised to a childless couple. So the middle is about £450 a week, a bit less than £25,000 a year. The bottom 10% is about £250 a week. The top 10% is about £900 a week. So this is a really important chart. I won't talk about it at endless length, although I would love to. That was what it looked like in 2013. What's really interesting is how that's changed over the post-war period. We don't have data that goes all the way back, but we do have data that goes back to 1961. Here is the 1961, and then this is just going to animate. So you can see in the 1960s, not much changes. There's some slight increase in average real incomes. This is all price adjusted. And there's a little bit of thickening of the tail, but not very much. That goes on being true through the 1970s. There's some small change, but nothing too dramatic. Watch what happens starting in 1984. So all of a sudden, in the second half of the 1980s, we see a really dramatic shift in the income distribution. So this tail thickens hugely, and there's a significant increase down at the bottom. Through the 90s, we go back to not very much radical change, and the same is true through the 2000s. So there are year-on-year improvements in average standards of living, but the shape and the position of the distribution of income doesn't appear to be shifting anything like as dramatically as it did in the mid-80s. So go back to 1963, and this is where we were by 2013. So there was in 50 years, that is a massive change in the position and shape of the income distribution. So the position, incomes, the middle of the income distribution has moved very significantly upwards, so people have got much better off. But the shape of the distribution has been transformed. So we've got this very relatively flat, that means more unequal, compared to what we had in 1963. Again, to emphasise when this happened, 63 to 73, there's not much change. To 83, again, not much change. But watch what happens now. From 83 to 93, there is a really varied, I mean, for economists, this is a lot of action. You know, and I have no idea how exciting this is. I mean, it's really very, and then again from 93 to 2003, not much change, and again 2003 to 2030. So huge change in the structure of the income distribution. And we could talk at great length, which I promise not to, about that. One way of summarising it is just to look at what's happened to income inequality. And a simple measure is the 90-10 income ratio, so just the income of the person at the 90th percentile point divided by the income of the person at the 10th percentile point. And all that data, and it was a lot of work, not done largely by me, I have to say. Essentially what it shows is that from 1961 to 1984, the 90-10 income ratio is 3. Over the next 5 or 6 years, it rises to 4. And since then, it's been 4. Actually, strikingly and importantly, it's either flat or, if anything, falling a bit over the last 25 years. So income inequality seemed to peak for the population as a whole, at least, in 1991. And you see this just very dramatic shift in the second half of the 1980s as incomes, particularly in the top half of the income distribution, rose very dramatically. And one of the consequences of that, and something to keep in the back of one's mind, is that's made the role of the tax system in redistribution even more important. So quite a large part of the so-called welfare state, the education and healthcare bits of it in particular, they're not particularly targeted on people with low incomes. They're targeted on people who need education or need healthcare. So the redistributive aspect of that comes not from the spending so much as from the taxation. And as the distribution of income has widened, the amount of tax that is paid by those on higher incomes has risen as their incomes have risen. And so an increasing amount of our redistribution is coming from the tax system rather than the spending part of it. As well as this change in the shape, we've seen change in the levels. So this just shows you in real terms the incomes, only going back to 1977 in this case. So in 1977, average household income, the blue is all households, the yellowy is working age, the red is retired, was about £12,500 a year. It's more than doubled in that period since 1977. But what is more striking than that is that while the incomes of the working age population, non-retired people here, they've roughly doubled. The incomes of those over retirement age, the average income of those over retirement age back then is about £7,500. By here, it's 22. So it's trebled. So retired people by the end of the period are on average 3 times as well off as they were in 1977. That has been an astonishing change. And that hasn't happened through the same thing happening at all points in the income distribution. But back in 1977, you see that the huge bulk of the retired population have incomes less than £10,000 a year. All of this is adjusted for prices. By 2016, we're seeing a much, much wider spread. The distribution of income, instead of being incredibly focused down here for the retired, is now widely spread. When the old age pension was first introduced in the UK in 1908, you had to be over 70, very poor and of good character to get it. 3 characteristics that were sometimes thought to be mutually inconsistent, because if you'd probably be dead. The distribution of income for the retired now looks like the distribution of income for the working age population. So when our social security system was introduced in its roughly modern form in 1948, being old and being poor were so highly correlated that actually using old age as a proxy for poverty was a sensible thing to do. That's simply no longer the case. That just compares the two distributions for 77 and 16. You see they are completely different. So in 2016, we simply didn't have any significant numbers of relatively affluent people over retirement age, and we had a huge number of people over retirement age on very low incomes. One of the consequences of that, and this is a rather complicated chart for which I apologise, both a consequence and a cause, is that the role of the state in the incomes of those over retirement age has been radically transformed. So this is essentially, this purpley bit is the large part of what the state does, pension benefits, and then this green bit, other benefits. In 1977, on average, the state was the massively dominant provider of income for those over retirement age. By 2016, you can see that the state pension is still significant and other cash benefits are not negligible. This is investment income, which has grown significantly, but private pensions up at the top. The combination of private income is as important as the state in the provision of income to those over retirement age, and that's an important thing to bear in mind. It's also worth striking that now we see the state getting involved in slightly different ways. So that increase in private pensions may continue, but is likely to change its nature, because in the last few years we've seen a massive increase in the number of people contributing to private pensions. But that's because they're almost being compelled to. They have to opt out not to, and if they opt out, they miss out on very large sums of money that otherwise would be available. So here we've got an area where the state is interested enough to want to try to force us to do something, but not quite interested enough or not convinced that it has to do it itself. I think that's an interesting thing just to reflect on. Now, when we think about things like pensions, one thing for us to think about is what is a pension? And for an economist, the most natural way of thinking about a pension is that it's a form of insurance. The thing you're insuring against when you take out a pension is living too long. Only an economist would put it like that. But that's what they are. You know, a pension is a way of guaranteeing yourself a certain amount of income until you die, whenever that happens to be. So this is a form of risk pooling. And I think another idea I want to leave with you is that most forms of what we think of as being the welfare state, what I'd like to think about possibly describing as collective provision, most of them are about the pooling of risk. And that's a very important thing to think about. Many of you will have seen me talk about this slide endlessly, almost always in the context of the provision of long-term care. And I'll talk about it terribly briefly in that context, but actually it has a much wider resonance. So in the context of long-term care, what this slide shows you is, imagine you took 165-year-olds, you line them up in order of their likely need for long-term care provision before they die, and you see slightly fewer than a quarter of us are not going to need any. We're going to die walking up a mountain in the glorious sunshine, have a heart attack, that'll be it. Most of us will need a little bit, and some of us will need an awful lot. And the problem in long-term care is that the possibility you might need an awful lot is rather scary. But there are lots of other areas of our lives where exactly the same structure of risks faces us. That's the structure of risk actually that faces us with pensions. You know, some of us are going to die before we get to retirement age. Some of us are going to die relatively soon. A few of us are going to live a long time, and we're going to need an awful lot. It's precisely the same shape for healthcare. Although in the case of healthcare, there probably isn't this bit down here. We drag it down here. But almost all of us will need some, but some of us are going to need an awful lot, and we don't know which of us it will be. It's not unlike it. You think about this as reflecting a particular risk to do with education. Before you're born, you don't know how many resources your parents are going to have that they could use to educate you if nobody else would do it. And you could be terribly lucky, you could be in the middle, or you could be very unlucky indeed. Now, in all of these cases, what we want to do as individuals and as a society is we want to say, well, we don't want anybody to face this extreme risk, so we'll pool the risk, and we'll put some form of insurance in place, either state social insurance, which is what the education system, the healthcare system, and the flat rate state pension are, or in some cases like driving, will mandate private insurance. You're not allowed to drive without insurance. So, and what insurance does is it takes this scary looking pattern. It says, no, everybody, this is what it's going to be for everybody. And of course that does mean that if you're one of the people who was going to be lucky and not need anything, you end up paying something. But we're all by and large happy to do that to avoid the risk that we end up here. And so I think that's actually the most fruitful way of thinking about almost all the areas that we currently characterize as being the welfare state. Certainly the way that we should characterize how we should think about long-term care, and that might get us to something sensible. Of course, there are many different ways of pooling risk. There isn't only one solution, and we've seen in the last 60 or 70 years different ways of approaching all of this. One last set of issues. We often hear people talking about whether we can afford the welfare state. That really makes me fume. Not because I have a particular view about how large spending on health, education, or social security should be, but because it's just a completely silly way of trying to characterize the issue. This is what's happened to the real level of national income in the UK since 1948 to 2016. So it's gone up by a multiple of rather more than 5. We're more than 5 times as well off as we were in 1948. So the suggestion that we can't afford A, B, or C is just it's not a well-formed formula. It's not a coherent way of describing what's going on. It's not just that income has gone up, but as a result of income going up, wealth has also gone up massively. So this is household wealth as a percentage of a measuring of income. So the ratio of households' accumulated wealth to the income in the economy has itself almost trebled at a time when income has almost trebled. Real wealth has gone up almost by a multiple of 9. The problems that we face are not that there isn't enough money, it's that we don't find it easy to make choices. Or at least we don't find it easy to make choices in the public sector. It's much easier to make individual choices than collective choices. But in areas where we want to pool risk, we have to make collective choices of one form or another. Sometimes we can do that in the private sector through private insurance. More often, we end up needing to do it in the public sector. Just to emphasize how easy it is as individuals and how much change we go through, this is a chart that just shows you what proportion of total spending by households has gone on food and drink. So back in 1964, 17%, now about 9%. There hasn't been much attention paid to that because that's just the easy, natural result of literally millions of individual freely made, or by and large freely made, not entirely freely made, but individual choices. That's something that's declined in scale. This is transport spending as a share of total consumption, and that's gone from 3.5% in 1964 to peaked at nearly 14% just before the crash, has been going up again. So as individuals, we make extraordinarily dramatic reallocations of our resources in response to changes in the level and composition of our income. We find that much more difficult in the public sphere, and we find it particularly difficult in the area of the so-called welfare state. And I think the changing balance between health and education and social security is an example of that. Not that I think that people didn't want health and social security to rise, but I don't think people as a whole, either politicians or the public, wanted education to fall. I think that's been a kind of dropout of the political structure. Change in the welfare state is inherent, and it's been huge. We've seen very substantial changes in the structures of social security spending in the UK and of education spending in the UK. We haven't seen very much substantial change in the way in which we do healthcare. And my hunch is that over the next 20 years, we're likely to, because the pressures that have led to that change in social security and education, I think will hit health too. As I said at the beginning, I'm no longer persuaded that welfare state is the most helpful way of describing this set of issues. I don't think it forces us to think hard enough about what it is that we're trying to do. I'm rather attracted by, well, I'm not attracted by the name collective provision. It sounds like some Stakhanovite 1940. I think thinking about new ways of characterizing this might be a good idea. I do think the pooling of risk is at the very heart of all that we do here, and that's a helpful lens through which to view it. And I also think it's important that we should recognize that when we advocate the pooling of risk or particular items of spending in this area, we should recognize that we're advocating it by and large on the basis of moral judgments, because we think that certain things are right, not because we think they're economically efficient. Many of these areas do bring some economic efficiency with them, but that's not the fundamental motivation for spending in education or healthcare or social security. The fundamental motivation, at least in my view, is a set of shared moral evaluations of the value of people and why we should look after them. Thank you very much.
We have a little time for some Q&A, and there's some microphones around. There's Sam here. While the microphone is coming to Sam, I think it is, the principle, pooling and collective provision in Europe tends to be called social solidarity, which definitely has a sort of moral underpinning. We, of course, we seem to be drifting a bit towards America in terms of our view on that, and the 1834 Poor Law casts a bit of a long shadow, I think, in some of our thinking about the poor particularly. Do you think the solidarity principle is at risk in sort of Anglo-Saxon systems, or perhaps even more widely?
I think it may be. I mean, I don't know how it is. I can't judge how much at risk it is, but we don't talk about it very much, and I think there's a tendency to focus very much on individual contributions and individual returns, and that often misses the benefits of solidarity. And one person's solidarity is another person's insurance. And it's interesting, I think by and large tend to find insurance being a description that those more market-oriented and on the right tend to find comfortable. Solidarity, a description those
it's got a definitely more redistributive feel to it, in the sense that...
but it can be exactly the same process described in those two ways. But I think in public debate, we often focus very much on individuals, and that misses some of this risk pooling notion, and I think that's a danger.
Yeah. Sam, just say who you are.
Sam Everington. As somebody originally from Norway, the second happiest country in the world, beaten by the Finns this year, thinking about your income distribution, is there any correlation or connection between that and happiness and health when you think internationally?
So I think the short answer to that is there may be some correlations. I'm not myself persuaded that we be convinced those correlations reflect causation. It's not a perfect thing. The measurement of happiness or measurement of subjective feelings is terribly important, but extremely difficult to compare cross-nationally. So I'm not sure. I'm not sure. There is certainly some evidence that changes in the levels of inequality within a country can have an effect on what that country feels like. But the cross-national comparisons, I think, are pretty tricky.
I think for quality of life, you have to recalibrate for the fact that the Danes seem happy with almost anything, and the Italians are dissatisfied with almost everything. And but for the same level of objective inputs, they return very different responses on quality of life.
That's measures. Right. Now, of course, if I were Danish, I'd be happy because in Denmark all data is available. So,
very good. So I've got Andy there and Nina Monty there, I think. Andy, do you want to say who you are?
Andy Cowper from Health Policy Insight and Health Service Journal. The figures on health and education relative spending are really striking in and among your presentation. Is one of the factors why we seem to have a greater willingness to increase spending on healthcare something to do with the fact that because most healthcare is consumed later in life, we can probably all imagine that we're going to need it. In contrast, we probably care about education somewhat while we're in it, a hell of a lot while our children are in it, and then beyond that, not massively.
So that is a part, although that's slightly distressingly sub-rational, but I suspect that's a part of it. And my own sense is that's not the most important part, that the most important part is that the Secretary of State for Health has always got a really vivid political downside to explain to the Chancellor if the Chancellor doesn't give her or him more money. Now, that's not unrelated to the point you make, actually, that the reason that hospitals, a crisis in hospitals has such political salience is that we can all imagine we might end up there and at any stage of our lives, and in particular as we get older. And so maybe that's partly why it's so politically fraught. So I think the two explanations are not independent of one another, and I think the point you make is a very important one.
You had a go at social care funding, and it's a very fine report, and there has not been significant action. What is your sense from that experience of why the healthcare argument seems to succeed, because we understand it in one way, and social care, it just does not get the traction?
Yeah. Well, I think it does go back to your point that I think healthcare, we all recognise that we're likely to need it. Social care, somehow, because it's not a very nice prospect, I think many of us are shutting our eyes. I also think, to be slightly more optimistic, we learn through experience, I think, often. We learn through doing, and our interactions with healthcare are frequent throughout our lives, and so we can see where that might go. The interaction with social care tends to be a one-off, tends to come quite late in life, and it's becoming massively more frequent. So my expectation is that over the next 20 years, as more and more families experience a family member needing social care, we'll get better awareness of it, and then we may get a more coherent political debate. Because one of the things that has been very distressing about being involved in the social care debate is it seems to, I think, most of us who are involved in it, really critical. That the system at the moment is not delivering the kind of provision that we'd expect in a society that has had the commitment to the health service that we've had, that's had the commitment to education and social security. This seems an extreme outlier, but somehow it doesn't seem to ring bells politically. And one of the things that politicians will repeatedly say is, well, yes, I can see that something needs to be done, but it's still not figuring in MPs' postbags. And that's to me, something of a puzzle, but I think it will change. I hope it changes.
Good, thank you. Nina.
Thank you very much. Nina Modi, Imperial College London. That was a great start to what I'm sure is going to be very interesting 2 days. You ended with a very stirring statement about the fact that sometimes moral choices are the imperative rather than economic choices. But could I put it to you that perhaps these two could be very usefully conflated? And the example I would give you are examples from both health and preventive health, not acute health care, and education. Because, of course, if one were, as a nation, to make the collective choice to put more funding into preventive health measures and all that implies, and into education and all that implies, then you could argue very plausibly that the need for social care spending down at the other end of the age spectrum is actually going to be reduced. And it would seem to me, not knowing anything about economic theory, but it would seem to me from a very simplistic point of view that there's a very powerful economic case to be made there.
So I certainly would never want to see these two sets of arguments as being opposed to one another. I think often it is the case that the thing that reflects our shared moral values will also have some economic benefits, but not always. And even in the case of something like so better preventive health might well reduce the social care budget a bit, but it could also significantly increase the pensions bill. So and that that's just a good thing. Because if at the moment we've got some groups of the population not having enough preventive help and they're dying early, that's a terrible and wrong thing. But stopping it, while it might reduce the social care bill, if it means they're alive for longer drawing their state pension, it's not necessarily going to be good for the public finances. So there will often be cases where these two arguments run alongside one another. My main point is that you can't make sense of the health, education and social security systems we've got at the moment without reflecting, well, that's come from some set of shared moral judgments that we've made. And I think we have rather lost the political discourse there. One of the reasons that it's difficult to get reform is that sometimes we're stuck in a rather narrow economic debate when something much wider is what's needed.
Thank you. Good. Any other points or questions? We've got two here. I think we've got time for both. Adrian, say who you are.
Adrian Masters, Public Health England. Could you say something about tax levels? It seems to me either we're going to slow increases in pensions and health expenditure as a proportion of GDP. We're going to either have to slow those, or we're going to have to raise tax levels.
So we are, yes. The answer to that is yes. One could characterize the post-war period. The immediate post-war period was a period when we increased spending in these areas by increasing taxation. There followed a period where we increased spending in these areas by cutting spending in other areas. There's nothing much left to cut. So either we increase taxes or we don't increase spending by as much. And that could mean making some very difficult choices. And one obvious difficult choice to make is the pension triple lock. So when the pension was introduced, it was to try to help poorer people who happen to be old. Now much of it goes to people who are not poor but have been expecting it. So you could say, well, we don't want to increase taxes, so we'll be less generous to pensioners. That might not be a terribly popular thing to do. Something is going to have to give, because there will be the pressure to increase spending in health will continue. The pressure to increase spending in old age will continue because of the numbers. So we're either going to have more taxes, that is, we'll do more collective consumption, or if we're not going to do more collective consumption, then we have to do less collective consumption. And that neither of these things is necessarily what politicians find easy. And they may not find it easy because we as an electorate may not make it easy for them, but I think there are some pretty difficult choices to make.
Has the discourse failed to keep up with the fact that, so I remember some of the 80s and 90s, a lot of the discourse was about pensioner poverty. Your slide suggests that that problem has largely moved and that poverty is now concentrated probably more about as younger people, but we're still in the way that we think about pensions policy are obsessed with the idea of from the 80s and early 90s.
So I think we still imagine that pensioners are likely to be poor. I mean, there's still some terrible pensioner poverty, but it's a much smaller share of the pensioner population than it used to be, and so that's something we have to face up to, I think.
Thank you. There's someone here. Oh, yeah.
Yeah, hi. I'm Caroline Jones from the Office for Statistics Regulation. So Sir Andrew,
has he committed some sort of offence?
No, he used to be our he used to be our chair, so I used to work for him. So hi.
All right.
I'm very taken with the idea of the collective provision, and that really speaks to a collective responsibility. So I think you're quite right regarding the public discourse. So I'm going to set a challenge for the Nuffield Trust, which is, can we call it the Health and Social Care Policy Summit next time? So you're actually including the health and social care, the whole concepts within policy, and that might make it better for politicians to actually start thinking about it as well.
Okay, we'll have a think about that. I'd like to drop summit, really, but thank you for that. Okay. Andrew, thank you very much indeed. Say thank you to you. Great start.